So we're going to use 3 different mechanisms around which we're going to kind of start to work on this. You good? Okay, so the first thing, you're going to just sit right there for me and face them. So this is a floss band. It looks like just silly tool or rubber band. The science behind floss applications is compelling. First of all, just compressing a joint. There are receptors in the system responsive to compression. And again, anytime you can feed the nervous system with a novel stimulus, you're going to get a reduction in pain. The brain wants input, and anytime we can assign anything to change the input, we're going to alter that pain expression. Because all he knows right now is there's a problem. We're going to shift his context for pain. So the first we're going to use is a rubber band. Compression, number 1. I'm going to move him with a band on, and the band is pinning the tissue. So as he moves, the tissues are being forced to glide and slide under each other. It's a forced ART. I do ART. And then lastly, there's a whole science behind the prospect of using a floss band. As soon as I take the floss band off, what do you think is going to happen? Blood flow. Perfuses the system with blood flow. Here's what we know about fascia. Fascia that's hypoxic, the characteristic of the fascia is uniquely different. It becomes more fibrotic in its presentation. So if all we do is infuse more blood and oxygen into tissue, we're going to change the characteristics of fascia. So with the floss band, here's the simple application. I'm going to get you to put your hand here, and you're going to kind of brace in and against me. You good? We go distal to proximal, 50-50 tension. And this will be tight. You good? Okay. Now I'm going to come up the shoulder. Now, I always do this one, and this is the complex one. You're not going to go in to the armpit. You're going to come up over the shoulder and basket through the shoulder, and then come underneath, and I'm going to close the window. So, rule, distal to proximal, 50-50 tension, 2 minutes. If it starts to get numb or tingling, that's not the intent. So the first thing, we can just put it on statically. But now what I'm going to get you to do is stand up, face them. And what I want you to do, let me just pin that off again. What I want you to do is take your shoulder. You're going to move this way, and this way. Go. It's going to feel tight. It's all good. Just a couple in that direction. Go forward and come back. So this is essentially his ranges of motion. This is what we consider an external glide and internal glide of those tissues. Now I'm going to have you lie on your side, face them. Yep. 2-minute window. I'm just going to get behind you. You good? I'm going to distract the joint, and I'm simply going to start to mobilize it with a band on. I've got a much better capture of the fascia in this position. And again, this is body weight. I'm not using any force. I can move into positions of external rotation and guide that. Is that comfortable for you? So these fascia lines are being essentially reset. I've got a compressive force, and these tissues are being forced to glide over each other. The second thing I can do is I can have you go on your back for me. Head right there. If you do any type of joint mobilization, I'll do a positional release. And this is incredibly effective because when you put the band on, you can have some very, very focused joint mobilizations. Gives you an opportunity to really capture tissue. So I'm going to take the shoulder, comfortable, and I'm going to compress it. So it's positional release of the articular ligament structures. So I'm going to hold this for about 20 seconds. It'll soften the capsule. And again, I talked about the idea that when I move the shoulder, the premise behind the mechanics of the shoulder anatomically is the shoulder just doesn't move in and out, up and down. It glides inferiorly. He's lost that. So I'm going to positional release, soften the structures. I'm going to take the shoulder, and I go right at the humeral head, glide inferiorly, and pump. How you doing? No pain, right? Perfect. I can do another positional release or another kind of MET with the band on. I'm going to glide it through motion. Mobility is everything. Sean talked about this. The beauty of this is all of us as a team, we're all talking the same language. We just approach it from different perspectives. What I want you to do is pull your shoulder down to the table and relax. That's got to be 2 minutes. Sit up for me. Spin around. And I'll pop this off.